If you've followed my work, you know that I consider omega-3 fish oil to be an indispensable part of my daily regimen, and that I've recommended it for my patients and followers for decades. If you're already taking omega-3s, you should know that I've discovered a product so special that it's become my go-to brand. Dr. Jeffrey Bland, one of the luminaries in the world of complementary health, takes omega-3s to a new level. Omega-3 Rejuvenate from Big Bold Health is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. Unlike most other brands, Omega-3 Rejuvenate does it differently. The product comes straight from the sea into the hands of skilled fishermen, instantly flash frozen, and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique process preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman for 20% off site-wide. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Today we're going to talk about something that I think can be of extreme benefit to our listeners, practical import. There are these devices now called CGMs, continuous glucose monitors. And today we're going to talk to an expert and talk about how they may be a pathway for you to optimize your health. And I'm not just talking about diabetics. Clearly, they're a boon for diabetics who need to control their blood sugar, need to decide when to take insulin, when to increase or decrease their dosage. Yes, of course. But today's guest maintains, and I heartily agree, that these CGMs, these continuous glucose monitors, can provide us very, very valuable insights into how to optimize our diets, our sleep, our exercise patterns, and can optimize health. So our guest is an emergency physician with 25 years in the ER, treating acute problems, basically triaging patients who came crashing in with all kinds of crises, injuries, but also metabolic problems. And apparently after 25 years of doing that, he said, hey, maybe, just maybe, we can prevent these people from going to the ER. And he began to turn his attention to metabolic medicine. He maintains a website, which is called metabolicmds.com. And by the way, we'll tell you about an offer of a free book on the subject of utilizing CGMs. He's Dr. Paul Kolodzik, Medical Director of Metabolic MD. He has an MD. He also has an MBA. He is board certified in emergency medicine, but also in preventive medicine. So welcome, Dr. Kolodzik. It's a pleasure having you on Intelligent Medicine. Thanks very much for joining us.
It's a pleasure being here. Thanks for having me.
Yeah. Fantastic. Well, first of all, tell us how you got, a little bit about your personal evolution from ER physician, dealing with mayhem to now attempting to prevent mayhem.
Yeah. So, what gets all the press in the emergency department is, just as you mentioned, the traumas, the overdoses, et cetera. But really, the bread and butter of emergency physicians, unfortunately, is the metabolic health issues we see. So it is the renal failure and the strokes and the heart attacks and the peripheral vascular disease. And those have a common denominator, and that common denominator is vascular disease. And I believe that a lot of that vascular disease has to do with high blood sugar. About 30% of American adults are pre-diabetic now, in addition to the 10% that are diabetic. Half pre-diabetics don't know it. And I believe the inflammatory result of high blood sugar causes a lot of these problems, also results in the epidemics of obesity that we have. So a few years ago, after realizing that, I decided to get out in front of this issue by opening my metabolic health clinic.
So let's take a look at the world pre-CGM, prior to the introduction of continuous glucose monitors, which happened roughly around 10 years ago, but they've only been perfected and popularized mostly in the past 5 years or so. What tools do we have at our disposal to determine if people were keeping their blood sugar under control, and how do they fall short?
Well, the issue there was finger sticks. You have to finger stick all the time, and people were somewhat resistant to do that. It hurts a little bit, and it was a hassle. But then CGMs came out and they provide 24/7 readings. You basically put a CGM on the back of your arm. These are the devices that you may have seen on the back of diabetics' arm. You connect it to the app on your phone and you get 24/7 glucose readings. So you can see how every food you eat impacts you.
So what about hemoglobin A1C? That's a popular way of determining whether someone is diabetic. What's the drawback to that in terms of determining how various things influence blood sugar, which include, not just diet, but the timing of your eating, the timing of your exercise, even sleep deprivation and stress can actually have an impact on your blood sugar, right?
Absolutely. And as you well know, and I think I've heard you talk about it, hemoglobin A1Cs give you an average of what's going on in your blood sugar for the last 90 days, the time that your red blood cells are alive, because hemoglobin A1C is the amount of glycosylated hemoglobin in your red blood cells. But CGMs give you these real-time readings. It's, there's a test called a glucose tolerance test. Pregnant ladies take some time where they, drink a sugary substance, and then you measure your glucose over the course of the next 3 to 5 hours. CGMs give you one of those every day. You get to see how what you ate just impacted you. And it's different for different people. Different foods impact different people in different ways.
And that's a good point, because there is this thing called the GI, or the glycemic index, which has been enthroned as the way to determine what the impact of a certain food might be on your blood sugar. So, for example, brown rice may have a lower glycemic index, less of an impact on your blood sugar than, say, a Coca-Cola, drinking a Coke, right? Which is, virtually a pure delivery system for sugar without any fiber whatsoever. But it turns out that the GI, it's different strokes for different folks, right? Some people react differently to foods which other people tolerate.
Yeah, CGMs are personalized medicine, so you get to really see exactly what is going on. And I use the device first diagnostically and then therapeutically. So I have patients come in my office, and we're talking about really non-diabetics and pre-diabetics, because I think these are tremendously valuable tools in that population, because it opens a lot of people's eyes. We put a CGM on and I tell them not to change their diet for 2 weeks. And my typical patient is, the metabolic syndrome patient. That's the patient that's overweight, hypertension, maybe, high cholesterol, increased abdominal girth. And they wear a CGM for a couple weeks, and they get to see what their normal diet does to their blood sugar. And as some of my patients have put it, once you see those graphs, once you see those spikes, you can't unsee it.
Mm-hmm.
And for many
it's
people,
a teachable moment. It's really a supreme teachable moment. It just really drives the message home about the impact of, one or another of these parameters, whether it's diet, sleep, exercise, and so on.
Yeah, they can have their doctor talking about this issue to them for years. But then when they see the graph and they understand, I have people that have gone so far as there are certain foods, once they see it, they are going to eat them again, or in, very, very occasional times. So it's just an educational process. And I do that in the first 2 weeks, along with fasting insulin levels, which I think can be one of the most valuable blood tests many people ever had. I think this might be a little blasphemous, but I think they're more important than cholesterol levels in many people. And then we can calculate an exact level of insulin resistance. We can get a good idea of what's going on with blood sugar variability. And once you see that, then you can put a plan together to help people reverse their metabolic syndrome.
Let me give you an example. Is a family member of mine, a young woman, who waited till she got pregnant till she was 40. And, obviously women who are 40 get a little more scrutiny, a little higher risk than young women who get pregnant. But when she went for her 2-hour glucose tolerance test, the doctor told her that she was slightly over the limits and that she was a little bit, quote, pre-diabetic, and that maybe she wasn't going to be diabetic when she was unpregnant, but during pregnancy that posed a threat to the pregnancy. So the doctor said, well, you need to be on a better diet, and didn't give her a lot of guidelines. I suggested that she get a CGM, even though she clearly wasn't diabetic. It was just some abnormal results on a 2-hour glucose tolerance test. And boy, she was really, really happy with that because she gained so many insights. Her diet was actually quite good. She was on an excellent diet, of high quality organic foods, but she highlighted certain foods that caused her to react unexpectedly. For example, buckwheat, a food that is high fiber, considered a really nutritious food. Well, it set her blood sugar into the stratosphere for some reason. It's kind of individualized, isn't it?
Yeah, absolutely. It's individualized. And then you can individualize a treatment plan based on that initial evaluation. So once you get the data from the CGM over 2 weeks, and we look at spikes, how high do you spike? I have people that come in and they think, oh, I don't have a blood sugar problem, and they're spiking to 180, 220, which is in pre-diabetic, almost diabetic range. We look at daily averages to help round out that picture. And then you also look at variability. Because people can have spikes followed by drops, and the physiology. You eat a carbohydrate, your blood sugar spikes, insulin gets released, and insulin often overshoots the mark, and then you drop. And that can be a cause in many people for the fatigue they get in the afternoon. Some people will go as far as to say it can cause brain fog or less mental clarity.
Mm-hmm.
So
Absolutely.
You get all this data. You get all this down and then you put a plan together. And for my patients, that plan is a low carb diet. And we talk about, what is low carb for them and what they can do. Intermittent fasting, both of those lower insulin resistance. And then actually the third component, because again, most middle-aged American adults that are overweight have insulin resistance. We look at focusing on an exercise plan that addresses that. And, I'm really a big a proponent of strength training, much more than cardiovascular training. I have my patients follow the American Heart Association guidelines for their cardiovascular training parameters, but I want them spending the majority of their time building muscle mass to decrease insulin resistance. And then, of course, we're all swimming upstream as we age in terms of losing muscle mass.
And I've come to realize that personally because I started out doing triathlons and marathons without much in the way of strength training. And, as I've gotten older, I recognize the importance of maintaining muscle mass. We're all, as we age, fighting a process of sarcopenia, which is progressive loss of muscle mass. And what's the relationship between muscle mass and insulin metabolism? There really is a very close connection, right?
Yes. I mean, the efficiency and the quality of the insulin receptors in your body is improved with increased muscle mass. Basically, if you can increase your muscle mass, you can increase, in simple terms, the terms that I understand, you could just soak up more insulin and more blood sugar by those organs. That's going to lower your blood sugar, and that's going to help you reduce insulin resistance. And, the reason for weight gain for most middle-aged Americans is that, historically, and we can talk about this or not as much as you want, historically, we ate this diet that was 25% carbs, 50% fat, and 25% protein. And then the food pyramid came out, and we were told that you really had to drop your fat percentage and you had to eat more carbs. And in my mind, when that happened in the early 70s, the epidemics of obesity took off. And then as expected, 10 years later, the epidemic of diabetes took off. So when I advocate for a low carb diet, I'm really just talking about going back to the way Americans ate for generations.
Indeed. And, even we can trace it back further historically, is the notion that breakfast could consist of breakfast cereal, dried processed grains that we then made even worse for blood sugar by insisting that people put skim milk on them and then encourage them to drink a hearty glass of orange juice. That became Americans' breakfasts. And what are your patients seeing when they consume a breakfast like that? Or maybe, a bagel with butter and jelly or something like that?
Yeah. So most of my patients, and I'm not saying you can't have a special occasion, but, most of my patients embrace low carb diets because they see their effectiveness in terms of weight loss, improved metabolic health, decreases in hypertension and cholesterol levels. And basically they don't go that route. I mean, they are more bacon and eggs. To be frank, they're more bacon and eggs people. I think as we have, focused on higher carbs and focused on cholesterol being the enemy, we've had these epidemics that I discussed. And I think that those are reversible, but they're reversible really only with the approach that I suggested, low carb intermittent fasting strength training.
So let's focus a little bit on the nuts and bolts of CGMs, continuous glucose monitors. First of all, how do you get a hold of them? Because, doctors are sometimes reluctant to prescribe them for patients who are not diabetic. They don't get it, that it can be a teachable moment for non-diabetics, for seemingly normal people. Also, insurers are reluctant to cover them, except if you're diabetic. They can be expensive. So how do you properly source them if someone is listening to this broadcast and they say, gee, I'd like to try that? What's the best resource?
Yeah, so they do need to be prescribed by a medical provider. And you're right, insurance coverage is variable. But what I found in my practice generally is that the complete 100% out-of-pocket cost for these is about $70 for a 2-week CGM. But if you have insurance, in Medicare, regular Medicare and Medicaid is accepted. But if you have insurance, that usually drops the price in about a half. So my patients generally pay about $35 for a CGM. I'm not insensitive to that cost. But I believe the information you get with a 2-week CGM, can be exceptionally valuable. And, if you want to look at it from an economic perspective, this can be life-changing for somebody, and it can change their long-term, lifelong medical cost profile as well. So I'm not insensitive to the cost, and that non-diabetics have to pay out of pocket for it, but I think it can be very valuable. And many of my patients, after doing this 2-week CGM, they want to use one going forward, at least intermittently, to continue to help guide their low-carb diet.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you.
Kyolic Aged Garlic Extract is considered by many to be the GOAT of garlic, the greatest garlic supplement of all time. For over 50 years, Kyolic Aged Garlic Extract has been the trusted choice for millions for safe, effective cardiovascular and immune support. Aged Garlic Extract's effectiveness is well documented in over 900 published scientific papers and studies. Kyolic Aged Garlic Extract is created by aging organically grown garlic for up to 20 months. This unique aging process makes aged garlic extract gentle on the stomach, eliminates the offensive garlic odor and taste, and results in safe, beneficial compounds found only in Kyolic Aged Garlic Extract products. Whether you're seeking ways to maintain healthy cholesterol or blood pressure levels, or strengthen your immunity, there is a Kyolic formula right for you. Visit Kyolic.com and learn about Kyolic's many health benefits. That's KYOLIC.com. Look for Kyolic at natural health stores nationwide and online.
Thanks for listening. Thanks for supporting our sponsors. They are what make Intelligent Medicine continuing free resource to you. And now back to today's guest, Dr. Paul Kolodzik. I was taking a bike trip, and I was out in Death Valley, and there was a guy by the pool. He wasn't on the tour with us, but he was a guy who was swimming in the pool, and he had, what I recognized to be one of these devices. It's like a little small, it looks like a patch, but it's actually a little bit of a disc. And, ordinarily, it's pretty unobtrusive. You wouldn't notice it unless you knew what these things were about. And I, chatted him up and I said, gee, I noticed you're wearing one of these. What do you think of them? And he was over the moon. He said, I was diabetic. My blood sugar was way out of control until I got one of these things. And now he says, I've turned things completely around. He says, my blood sugar is normalized now. But tell us a little bit about the mechanics of these things. How are they applied? How long do they stay on? Can you swim and shower with them? What's the deal?
Sure. So, we call a prescription into our patient's pharmacy. They pick them up. They apply them to the back of their arm at home. It's really a simple process. It doesn't hurt. It places a little sensor like a filament.
It has like a little auto injector, which is a device that's kind of a spring-loaded thing, and it kind of shoots it with the adhesive onto the back of your arm. Now, admittedly, there is a little tiny pin that goes about, I don't know, a millimeter or two under your skin, but it doesn't really hurt when it goes in. Yeah. Right. I mean, maybe there's the initial snap when it with the auto injector shoots it onto you, but then it adheres. It's self-adhering, right?
Correct. Yeah. And then you wear it for 2 weeks. The sensor under the skin picks up the blood glucose in that area, actually the blood glucose reading in the intracellular fluid, which is right next to the capillaries. And so it gives you 24/7 your blood glucose reading. And then, but we, have a lot of our patients actually wear patches over them, just like you mentioned, and they really don't have problems with keeping them on. Mm-hmm. There are a couple different devices. One, you have to scan every 8 hours to make sure that all your data is collected. There is now a Bluetooth version where you get 24/7 readings
on your phone
without scan. Yeah, on your phone. So you just basically look at your phone and you see the graphs. You see your spikes, you see your drops, you see your averages. It's just a lot of good data for people to follow. And again, for a lot of people, this is life-changing because they really didn't have any idea they had a problem to begin with, or really didn't know, how high their blood sugar was running. And I think these devices are of tremendous value, especially in people that are pre-diabetic. So if you have diabetes that runs in your family, or you're middle-aged and overweight, it is worth looking at this, because in my mind, I don't know how you feel on, but in my mind, pre-diabetes is really an important time, because pre-diabetes can be reversed so that you never progress to diabetes. But once you're diabetic, you're probably going to have some insulin resistance for life, and you aren't going to be able to reverse that process completely. So the time to get on it is when you're pre-diabetic.
And even if you're not diabetic, what are some of the issues that arise when you're pre-diabetic? Because it goes way beyond abnormal blood sugar and the effects of abnormal blood sugar, such as eye damage and kidney damage and loss of sensation in your toes, so-called peripheral neuropathy. These are the consequences of high blood sugar, but it can be a signal for metabolic syndrome, which is a constellation of problems, right? That are very germane in terms of stroke, heart attack, even cancer, right?
Yeah, absolutely. High blood sugar begins the vascular inflammation process, and you got blood vessels all over your body. And that's why you see all those different conditions that you've alluded to there. The kind of the party line is that anytime you have a blood sugar over 140 or so, there's some kind of vascular inflammation going on, because just like the blood glucose molecules attached to the red blood cells related to the hemoglobin A1C discussion we had, they're also attaching to your vascular linings. And so once that process begins, it can progress. And the time, again, I think people should get on it is right at the beginning of the problem when it's reversible.
And it's a very empowering tool because people love a report card. They love feedback. And, when you're dealing with this and working with a health professional, you kind of wait between blood tests. And maybe if you're relying on a hemoglobin A1C, you've got to wait 3 or 4 months before it makes sense to repeat a test. And you go, okay, I started out at an 8.5. Now I've gotten down to a 7.2. I'm making progress here. But with this, you get immediate feedback on a day-to-day basis. You can actually see your average blood sugars declining. You can see the spikes reduced, and the roller coaster ride kind of smoothed out into more even rolling hills. Which is more the normal response to blood sugar. So I think it's a teachable moment, very empowering, and a really great way to find out about how you're responding to. Whether the measures you're undertaking, whether they be dietary, exercise, and so on, whether they're working. You've actually written a book about this, the continuous glucose monitor revolution for diabetics. I'm sorry, for non-diabetics. For not that the key word is non-diabetics, and you're making a very exciting offer to our intelligent medicine listeners. They can get a complimentary copy of this book. How can they go about doing that?
Yeah, they just need to go ahead and contact me through my website, metabolicmds.com, and we'll go ahead and send them a PDF of the book.
Okay, Metabolic MDs, that's plural, MDs.com/free book is the way to get a hold of the continuous glucose monitor revolution for non-diabetics, which answers a lot of questions about this exciting paradigm. Okay, when we return, we're talking a little bit more about CGMs, how they work, what information they can provide. But also we're going to venture into the realm of, it's the elephant in the room, these new drugs that can dramatically reduce weight and improve blood sugar. What role for diet and exercise makes sense to use an all of the above approach, even if you're taking a shot or a pill that reduces your appetite, makes you shed pounds. Today's guest, Dr. Paul Kolodzik, has been thinking long and hard about it and has some ideas to share with us about that. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast.